Hey guys, I'm Dr. Eric Gifford with 417 Sports Medicine Orthopedics. I'm coming to you today because I want to tell you a little bit more about PRP and regenerative medicine. There's a lot of misinformation out there. There's a lot of clinics that just really want your money and they're not really about helping you. And we want to make sure we dispel some of those misinformation and rumors and try to explain to you what it is, how it works, and why we use it. So let's start with what is PRP, platelet-rich plasma. Platelet-rich plasma is derived just from your own blood. So a patient would come in and we would do a vein puncture and we would draw a certain amount of blood from their arm, typically their arm, and then we will spin that blood down and separate the red blood cells from the plasma, and then we concentrate that plasma to what we call platelet-rich plasma. Now, platelet-rich plasma contains what we want to use to help either regenerate or help heal a certain tissue area. So if you look at this example here, this is just blood that's been separated. And so this just, you can see the red blood cells on the bottom, you can see plasma on the top, and there's a layer here in the middle that's rich with platelets, and that's what we're going after. We would call this the buffy coat layer or the platelet-rich plasma. So this is just a picture of an example. Now what's contained in there? Lots of things are contained in there. You have platelet-derived growth factor, insulin-like growth factor, fibrin-like growth factor, vascular endothelial growth factor, lots of other cellular signals that help your body create a healing response. Now, you'll hear the term stem cells. You'll hear it used a lot. It's used inappropriately in most cases, but stem cells means that a cell can start out as one thing and become something else. Now, pluripotent stem cells, like say in an embryo or a newborn baby, those stem cells can literally become anything. They start out as a sperm and an egg and they turn into a baby or an adult for that matter. So that is cells that literally can become whatever the body tells them to become. Now, you can't take cells from your body, from your blood, from bone marrow, from fat, from amniotic donated tissue and expect to get cells that can become anything. That's something your body is born with, and once you're past that point, you cannot get those cells. What we can get is, again, regenerative treatment out of platelet-rich plasma. You'll hear other regenerative processes that use bone marrow. So what can you get out of bone marrow? Well, you can get some hematopoietic stem cells. What is a hematopoietic stem cell? That's a blood stem cell. That means it's a stem cell that your body can make into a white blood cell, a red blood cell, platelets. It can make itself into basically blood, but that cannot differentiate itself into a new joint. So let's say healthy hyaline cartilage. You can't put that into, say, your brain and make neurons. It's going to make blood stems, or it's a blood stem cell, and it's going to make some form of blood. But it can be used to help coordinate a healing response. So let's talk about why, well, and you'll hear other terms such as, well, hold on, let me backtrack here. So other types of stem cells, you can get mesenchymal stem cells from adipose tissue or fat. So we actually will do some liposuction. They can take some of those cells out of there. But again, those are not going to be able to differentiate themselves into whatever tissue they're put in. They are really more or less fat stem cells, and that's not going to grow new healthy cartilage or grow a new disc in your back or grow new neurons in your brain. It just doesn't work that way. So all of the processes that we have can create a healing response in your body. So let's talk about that. Let's say I had a scratch on my arm, or let's say I had a cut on my arm and I needed stitches. Well, that's going to be an opening, it's bleeding. What's going to stop the blood? Platelets. Platelets are going to come to that area and they're going to start to aggregate. And those platelets are going to create a clot and it's going to stop the bleeding. Once those platelets create the clot and they create basically a scab, then it's going to start directing the healing process. So platelet-derived growth factor is very intricately involved in the remodeling process of scar tissue. So those are going to start releasing their factors and telling, hey, we need to recruit and get this tissue to heal. Insulin-like growth factor helps pull energy storage from the body and keeps the metabolism going in that area. Vascular endothelial growth factor helps bring blood supply and new microvessels to that area to help provide blood support or nutrient support. Fibrin-like growth factor helps create the fibrous bridge across the cut or the laceration. So let's just say that takes about 2 weeks, and then the scab kind of falls off. You see a little pink layer of skin. That's fibrous tissue that has bridged that gap. It takes another month or even a couple months for that area that was either cut or again, a scratch to completely heal and remodel where you can't tell it was there anymore. So that takes time. So does platelet-rich plasma. It's not an instant response. But what we're trying to do is we're trying to create that healing response by the body. So we take a concentration of platelet-rich plasma. So with the blood that we draw, we concentrate it to the platelets and the growth factors, and we can put that in an area where we're trying to get a healing response. Now, again, are you going to grow a new healthy knee because we put PRP in your knee? No. This is not going to replace your worn out cartilage. Let's just turn over here. So let's say you have an area in your knee that's missing cartilage. If we put platelet-rich plasma in there, that's not going to regrow that cartilage so that it looks completely young and healthy again. That's not how it works. We can hope that it creates some calming effect of the raw irritated surface. We can also hope that it creates a little bit of a fibrous scar tissue over it, just like the scar tissue we created with a cut or laceration. We can try to create a little bit of a scar tissue over that, but that's still not brand new healthy cartilage. So anyone out there that says, hey, we're gonna do stem cell treatments for you and we're gonna grow you a new knee and you never have to have surgery, that's just not true. It couldn't be farther from the truth, and really they're just scamming you. I'm just being honest. Now granted, they may give you some pain relief because any of these regenerative treatments can help with pain and they can help buy you more time, but it's not going to take you from here to here. It doesn't do that. It can calm the situation, it can really control inflammation, and even it's been shown that it's better than corticosteroid injections and hyaluronic acid, but it's still not going to take you from severe OA to a young healthy knee. That's just not how it works. So again, we're trying to create that regenerative healing response, but we know that it has some limitations. We know that we can't take you from here to here. We know that we can't make your discs in your back as good as new. Ultimately, we're just trying to calm down an irritated area and help it scar in and heal. Other areas where we use platelet-rich plasma are chronic tendinopathies. I can personally vouch for this. I actually did one in my elbow. So chronic tendinopathies describe a lot of different processes in the body. A common one would be tennis elbow, so lateral epicondylitis, golfer's elbow or medial epicondylitis, Achilles tendinosis, plantar fasciitis, jumper's knee, so patella tendinitis. There's lots of different areas. Even in the shoulder, we have rotator cuff tendinopathies. So these are all tendons that get worn out with time and use, and so the tendon gets thickened and disorganized, and it can cause a lot of pain. Well, when we put platelet-rich plasma into that tendon, we are creating a healing response. We're trying to create a disorganized tendon into a scarred down, healthy tendon again. And again, we have tremendous success with that. I did one in my elbow after having just a miserable summer last year. I couldn't pick anything up, lots of pain and problems. I did a PRP injection, and actually I only did one injection. It was complicated by I had a big back issue at the same time. Regardless, I can honestly tell you that I have zero pain in my elbow now. It took a few months to get there, but honestly, I love the outcome. And again, it can do amazing things for chronic tendinopathies. So I think I've gone through how it works. I want to go through, again, why we use PRP versus some of the other things that you can use. So all of the regenerative treatments that you have out there, platelet-rich plasma was probably one of the first ones used. It's been around for, I'm going to say 30, 40 years. Okay, this is not something that's new. It's just, still trying to get its grip into modern medicine. The second one that came out that people were using was bone marrow aspirate concentration, or BMAC. They thought that if you can get some hematopoietic stem cells from the bone marrow, usually the iliac crest, that we could create an even more robust healing response, or that we could create some of those stem cells may actually differentiate themselves to a tissue such as cartilage. Unfortunately, that really hasn't been the case, and in the grand scheme of things, ultimately platelet-rich plasma performs basically equivalent to bone marrow aspirate concentration, and it's much more affordable and it's much less invasive. The other one would be adipose. So again, they were able to take some mesenchymal stem cells from fat, and they can concentrate that, and we can inject that into tissues, hoping that those mesenchymal stem cells would also maybe differentiate and help the healing process. Again, unfortunately, we were unable to really show that that was significantly more beneficial. Very similar outcomes to just platelet-rich plasma alone, and again, much more affordable, much less invasive. The other regenerative treatments that are out there, these are a little bit more, I don't know, in fringe medicine. This is usually allograft or donor tissue. So this means somebody, usually it's a amniotic derived compound. They're taking donated placental tissue at C-section deliveries. They're taking that to a lab, and they're extracting growth factors from the placenta and from the umbilical cord, and they are taking those growth factors and then putting them into some type of a solution that they then can be injected into tissue areas. The problem with that is, again, it's very expensive. There's some questionable ethics involved because they're taking other people's tissue. There's all kinds of things that go on here. They really haven't shown that that's been much more effective than just platelet-rich plasma alone. So again, you got some really expensive, somewhat invasive options, but in the grand scheme of things, PRP, very equivalent with outcomes and much more affordable and much less invasive. That's why we still use platelet-rich plasma pretty much exclusively. I've used some of the other avenues, and again, studies do not show that it's more effective. And I agree, I've used some of those other ones, and I still come back to, I think, PRP as probably your best option for orthopedic biologics. So that's why we use PRP. And this is where I really want to, I can't harp on this enough. There's a lot of places around the country that will advertise regenerative practices, orthobiologics. They will throw stem cells out there at you. And I'm telling you right now, most of them do not have your best interest in mind. They are strictly making money off of what they think is, or what they're telling you is a cure-all. What they're telling you is, we can help you avoid surgery. We have places literally in the Springfield area that will pay for you to go to a steak dinner so that they can scare you out of having surgery and convince you to have, say, a bone marrow aspirate concentration injection for $5,000 to $10,000 and tell you that you're not going to ever have to have surgery. And that just isn't true. Again, they can give you some benefit, just like we can with platelet-rich plasma, but you're not going to never have a problem again. Again, your knee is still worn out. We're just calming it down for a while. I say knee, your joint, your hip, your elbow, your ankle, your foot, whatever we're putting it in. Again, it can improve temporarily, and again, sometimes that temporary relief is great, and again, we can avoid surgery for a long period of time, but ultimately, your knee is definitely still worn out, or your joint is still, I keep saying knee, I'm sorry. Your joint is still worn out, and it may still require a replacement in the end. So, again, if you want an honest approach to regenerative practices or regenerative treatments, I try to give you all the details. I want you to understand why we use what we use. I don't want to scare you away from surgery, because sometimes surgery is still your best option. Sometimes a corticosteroid is your best option. Sometimes we still try hyaluronic acid. There's lots of things that we can do, and I don't want you to think that, you getting stem cells is going to replace ever having to have surgery, because that's just not true. So again, if you want to have a conversation about platelet-rich plasma, come see us. I'm going to shoot with you honestly. I'm going to give it to you straight. If we think we can help you, we're going to do it. If we think, hey, you really need to just go have it replaced, we're going to tell you that, and we're going to be upfront and honest with you. So the other thing I wanted to talk about was how we do platelet-rich plasma. You can see this is how the kits that we currently use come. We typically will draw blood, we fill up the canister, and this is what the canister looks like. So we're going to fill up that canister with blood. We also use some anticoagulant, and we're going to spin that down. The first spin is just getting rid of the red blood cells. So we're just getting the RBCs off. Then we transfer the plasma into a separate container. We then spin that separate container again at a very high speed and for approximately 6 minutes, and that gives us a ultra concentration of the platelets in that plasma. We then take off the excess plasma off the top, and we get that layer in between that we're looking for, which is called the platelet-rich plasma. So I wanted to say this because we use a 2-spin technique. We've also used a single spin technique in the past. I like the 2-spin technique because it gives you a little more control over what you're getting. So if we want a leukocyte rich, which means there's white blood cells in it, or we want a leukocyte poor, which means there's no white blood cells in it, there's just platelets and plasma. Or let's say we're going into a really small joint like the AC joint. We're gonna want a small amount. We're gonna get a concentration down to probably 2 cc's, no more. If we're going into an elbow, same thing, we want a small amount. If we're going into a large joint like a knee, we can accommodate 6 to 10 cc's of PRP easy. So depending on what we're going to, depends on how we concentrate the plasma. And again, this double spin gives us that capability. I'm just telling you this, other places that do platelet-rich plasma can be using something as simple as a test tube. If you look at this test tube, it has a little anticoagulant as the fluid inside. You also have this gel down at the bottom, and that is a separator. So basically, all you're doing is taking approximately 10 to 12 cc's of blood, you're spinning it down, your RBCs will be below the gel separator, and you'll have plasma on top. I gotta be honest, that's not platelet-rich plasma, that's just plasma. And you can inject that, and sometimes even needle fenestration in plasma can be beneficial, but that is not the same thing as using some type of a dual spin kit where you're going to get a much more significant concentration of platelets. You really need significant quantity and quality. So if you take a large amount but you're not getting it concentrated enough, you're still not getting good quality. If you're getting a really small quantity and you're concentrating it, you may still not get the desired effect because you just don't have enough of the quality. This is a couple other techniques that we have. This is called Y-cell. This is again a very small blood draw, but it gives you a very concentrated plasma in this little, what they call Y-cell area or separator. So depending on what joint we're going into, sometimes we will use something like this, particularly if we're going in something very small like the hand. We can't put much quantity in there because it's too small of a joint. Just like the AC joint, again, we want a very small concentration. So there's lots of different types of PRP, and I would just tell you that not all PRP is created equal. So if you see somebody advertising, oh, I do PRP for free, it's part of your membership, or I do PRP for $100, well, guess what? You're probably getting what you pay for there, because ultimately these kits are very expensive, and if you're getting something for less than $100, then again, that's not true platelet-rich plasma. You can put blood in a test tube and spin it and take some plasma, but that's not going to get you the results you want. So again, with that being said, not all PRP is created equal, and not all regenerative practices are as upfront and honest with you as I am, because I really want you to understand why we're doing it, what we're doing it, and how it works. So I'm trying to think of anything else I didn't cover. That's pretty much it. I wanted you guys to understand what PRP is, how we use it, what it can be used for, and how it benefits you. Oh, here's the last thing. Platelet-rich plasma is not an immediate pain relief type treatment. When you do a platelet-rich plasma treatment or anything regenerative, you are trying to create that healing response. And if you think about how does healing work, how does scar tissue form, it takes time. So let's just, for instance, let's say you were to have surgery on your shoulder and they were to repair your rotator cuff. They're going to keep you in a sling and tell you not to move your shoulder for probably about 6 weeks. Why? Because that's how long it takes the fibrous scar tissue to form, and that way they know that whatever they operated on has healed, and then they can start moving it, using it, and working it. Same thing with platelet-rich plasma. We don't necessarily immobilize you, but when we inject that, we know it's going to take time in order to heal. This is not a good solution. If you're fixing to go on a trip and you want a quick pain relief solution, that's not a good option. We're probably going to try something else like a corticosteroid. But if we want to create that healing response and we want a more long-term effect, that's where PRP is definitely beneficial. The last thing on this is I typically use PRP as a treatment series. So I use PRP on a first-time treatment. We usually will come back in around 2 weeks and we'll do a second treatment, and then we usually top it off, I call it the icing on the cake, at about 6 weeks. There is great evidence that says, PRP is effective. There's even better evidence that says PRP is more effective when done as a series. Where the literature is mixed is how you're supposed to separate it. Should you separate it by a week? Should you separate it by a month? Should you separate it quarterly or even annually? I like to follow the scar tissue formation theory, which again, as scar tissue forms over 6 weeks, that's when I'm going to be giving you those PRP treatments. So we do one, we wait 2 weeks, and then we wait 6 weeks. But again, a series is still definitely more effective than just doing a single injection. The other thing I'm going to tell you is that there's some really good literature that came out that was trying to discover, like, how long does PRP really last? How is it effective? Well, they were looking at, like, when does inflammatory mediators start to come back into the tissue or to a joint? And what they found was somewhere around 9 to 12 months is when PRP, or the effects of PRP, basically have worn off. And so that basically said, okay, rather than wait for it to start hurting again, sometimes doing a annual PRP injection, and say in an arthritic knee, helps keep that inflammatory, those inflammatory mediators and the pain and the inflammation from ever starting back up. And that really helps keep things at a minimum. So again, we use it as a series. I think we have probably the best pricing in town. And again, I'm not going to do PRP for you unless it's appropriate for you. And I would love to consult with you and give it to you honestly. Like I said, there's a lot of misinformation on the internet. There's a lot of misinformation just in clinics around town. But again, I'm going to give it to you straight and let you know exactly how it works, why it works, and whether or not it's right for you. So if you're interested, give us a call today. I'd love to help.